Next, we'll talk about coronary circulation. So coronary circulation is necessary because the myocardium is too thick for the diffusion of oxygen. So the blood that's in the chambers can't get oxygen to the entire heart muscle. So coronary arteries and veins are part of the systemic circulatory system, and they are going to bring oxygenated blood to the heart muscle. So the coronary arteries are going to carry oxygenated blood to the heart muscle, and you can see in the picture that those are colored red because the blood is oxygenated. The right coronary artery and the left coronary artery branch off of the aorta almost immediately after leaving the left ventricle. In the image, the pulmonary trunk is removed, so you can see where the left coronary artery is actually exiting from the aorta. The right coronary artery is going to bring blood to the right atrium and the right ventricle. The left coronary artery actually splits, and the circumflex artery wraps around the posterior side of the heart and brings blood to the left atrium and the left ventricle. And then the other branch is the anterior interventricular artery, which is going to bring oxygenated blood to the interventricular septum and the left ventricle. Coronary circulation is very inconsistent. There are several main arteries that most people have in about the same places, but it is very common for these arteries to develop slightly differently in different people and not always be in the same place. It's also really common to have something called an anastomosis. Anastomoses are vessels that connect between other vessels and create these channels between arteries. So different people can have different anastomoses, creating even more variety in the circulation. So coronary veins, and pictured here we have the anterior side of the heart on the left and then the posterior side of the heart on the right. And coronary veins are going to carry the deoxygenated blood away from the myocardium. So these have already delivered their oxygen to the heart muscle and are now going to return to the right side of the heart. All of the coronary veins drain towards the coronary sinus. This is a larger chamber that collects venous blood. On the left of the picture, you can see the small cardiac vein, which is going to drain the right atrium and the right ventricle. The great cardiac vein drains the left atrium and some of both of the ventricles. And then on the posterior side, you can see the middle cardiac vein, which drains mostly the left ventricle. All of these, again, are going to drain towards that coronary sinus. So the way that this blood returns to the heart is actually directly into the right atrium through the coronary sinus. The coronary veins are even less consistent than the arteries as far as their branching and structure from person to person. So it's very common to have major differences in the coronary circulation of both arteries and veins when you look across many people in a population. Coronary artery disease, or CAD, occurs when fatty plaques are going to build up inside of the arteries. So as the plaques build up, they make the artery diameter smaller, which means that there is less room for blood to flow, which causes a decrease in the amount of blood that flows through the arteries. Because there's less blood flowing through the artery, we're going to see less oxygen getting delivered to the heart muscle. Coronary artery disease is the #1 leading cause of death worldwide. Coronary artery disease typically also does not have symptoms. You can't tell from the outside that you're developing CAD. Most of the time, people don't have symptoms of this. The only symptom that is common is called angina pectoris, which is pain in the chest. So coronary artery disease can cause a myocardial infarction or a heart attack. What happens is if the plaque causes the artery to rupture or to clot off completely, stopping the blood flow, this will lead to the myocardium not having oxygenated blood and therefore not being provided with oxygen. When those muscle cells don't have oxygen, they infarct or they go through muscle death. Survival of a myocardial infarction is going to depend greatly on where the infarct occurred. So what part of the heart was it? And then, of course, how much damage was there? A smaller infarction is going to be less problematic than a larger infarction. Some of the most common risk factors associated with myocardial infarction are things like smoking, having an elevated blood pressure, having diabetes, different lipids in the blood, so things like low-density lipoproteins or LDLs, having obesity, and then being aged over 40. When somebody does have a heart attack, there are often symptoms of pain, shortness of breath, sweating, anxiety, nausea, and vomiting. And then those symptoms might cause somebody to go to the hospital and then have the heart attack diagnosed and treated. It is, however, very common for those symptoms to not appear in women. So sometimes myocardial infarctions are missed in women because they don't show the same acute symptoms of a heart attack. Coronary artery disease can be treated in multiple different ways. Lifestyle changes such as decreasing obesity, blood pressure through increasing healthy lifestyle habits, stopping smoking. Familial cholesterol might be helped with things like medication to help reduce cholesterol. And then if the coronary artery disease is very severe or has already caused a heart attack, then surgically it can be treated with coronary artery bypass grafting, where arteries are surgically implanted from one coronary artery to the next to create those bridges between the arteries. And this is going to provide an alternate blood route to allow more blood to come to the myocardium or to bypass a clogged coronary artery.